I'm Gerry Sampson. Teledentistry. Is this part of the new norm that we now see ourselves in? The new norm. I'm not sure what's normal. We don't know what's normal yet. We're still evolving through and with this situation. Teledentistry. Well, I understand telemedicine, that a dermatologist could have a picture of something on my hand and maybe tell me a bit about it. But that dermatologist would probably also say you need to visit the office. Well, with teledentistry, when is it appropriate? When is it not appropriate? For patients of record, where you have already seen the patient, well, perhaps judgments can be made when teledentistry is appropriate. But what about new patients? Is teledentistry an appropriate thing to have for new patients? How does the business of teledentistry, and therefore the need to avoid personal protective equipment with a teledentistry or distance visit, well, you wouldn't need protective equipment for you or for the patient or the parents at that time. I met with Rob Delarosa from Baton Rouge, Louisiana. Rob has 4 offices. He's past president of the American Academy of Pediatric Dentistry. He's a board-certified pediatric dentist. I met with Rob and Michael Schwartz. Michael is the CEO of Specialty Dental Brands, a substantial dental organization, or DSO, dental service organization, with an excellent and emerging track record. The important thing to know about these two people is they are ethical. They have great judgment, and they are doing what's right. They're doing what's right for the patients, but they're also doing what makes sense in business. Business, gross profits. I think I know what that means, but what is gross margin? I don't know. Do you? Why is it critical to understand that? I don't know. Do you? What about break-even metrics? Well, I think I know what break-even means, but how do you figure that out? What if I'm not capable of figuring that out? What should I do about it if I'm going to thrive and prevail during this very, very challenging time? You can contact me for a PDF file, a transcription of the conversations that I'm having with Rob Delarosa and Michael Schwartz. Just send me an email and I'll be happy to send you the transcript. Let's hear what these people have to say. With Michael Schwartz and Rob Delarosa. And we're talking about the changes that are essential moving forward into what we are calling the new normal, but we don't know what normal is yet, because this is a fast changing issue. Well, one of the things that we know is going to be coming in a big way is teledentistry. What Rob has just been talking with Michael and I about is teledentistry and how he feels about it now and what he has already been doing. Rob, continue on, please.
Yeah, so in our discussion, we briefly talked about our call system. So in our call system, if we get a call from a patient on the weekend with technology as it is and with encryption, we'll have them send us photos of the trauma. And then, like you had alluded to earlier, we'll make a spot decision, was come to the office now, or, yeah, bump the lip. Let's do this. Let's treat it, symptomatically, palliatively, and then I'll check back with you, tomorrow, whatever it is, doing it like that. So, but the issue behind that we talked about was getting consent, and I think that's where the things have to be tightened up, because we have some verbiage on our call line that says, we do offer the teledentistry service for emergencies that occur like this. If you consent to this, then go through this number, and then it links up to the doctor. You see, so it's an evolving thing. It's changing, but like you and like Michael had said earlier, I think it's going to be a part of the future for us. I think it's inevitable.
One of the things that I had mentioned was the establishment of the doctor-patient relationship. And let's say this is not a patient of record. If it's a patient of record, I think things are much clearer. And we were talking about my close friend, Larry Gerald, who's an orthodontist lawyer and has a degree in ethics and the humanities. Larry, with
some assistance from me, although minor, we have already developed a teleorthodontic form that is going to be published. So anyone listening is welcome to email me, and courtesy and generosity from Larry Gerald, I will send you that form. The establishment of the doctor-patient relationship. Well, if they're already a patient of record, as Rob is mentioning, you have a relationship. Remember that just as I'm doing now, you can record your teledentistry visit. You have to get their permission. They have to state, I'm giving you permission to record this teledentistry visit. I think that is absolutely essential, because now you know what was said. Everyone knows what was said. And if during the teledentistry consult, you make the decision the patient needs to be seen, it is absolutely critical that you tell them in what time frame. Do they need to be seen tomorrow? Do they need to be seen today? Do they need to be seen in a week? They need to understand what that time frame is. That is a dental professional. I can assure you we are obligated to that. So, Michael, from a corporate standpoint, how comfortable are you as the leader of a substantial corporation in now incorporating teledentistry into the business?
Absolutely. I think one of our core values at our company is, we call it tech savvy. We want to be moving forward with technology. Dentistry is often described as a cottage industry. I think from my 12, 13 years in the business, I've learned from a lot of dentists that if you went to dental school in 1940 and learned how to do a filling, you could still do it that way and have a good outcome. So there's a lot of that. What you hear is, it's always been done this way, and that's been a lot of dentistry. And when I first got into specialty, there was a lot of pediatric dentists, and still, I don't know what the percentage is today, but 4 years ago, 50% of pediatric dentists were still using film. When you go to your medical providers, they're not using film; they're digital, right? And so I think that this crisis that we've had with COVID is going to push the dental industry to adopt more technologies. And I think, a lot of people have digital practice management software. Not a lot of people are still manually charting. There's a good percentage of dentists that are still manually charting. They stepped in and started using the practice management software to do appointments and do the ledger, but they still charted manually. So when you get to teledentistry, this is something that we're going to move full force into. And again, I think we have to take a step back, because sometimes the years move past you pretty quick. If you think about a parent, when you're in children's dentistry, if you think about a parent, if you're 30 years old, you were born in 1990. I mean, these are a millennial generation. Your parent base is going to start becoming a millennial generation predominantly. The millennial generation is used to technology. They're used to be able to go online and find out everything they need. And I think dentistry has done a good job with websites and providing information. We're not really good about online scheduling. I can go on my primary care doctor, click annual physical, look at his whole calendar, pick my appointment, it books it in their software. There's a couple people that have tried that in dentistry. Doesn't work so great. They're trying to get better. I think with teledentistry, you can adopt it for certain things. In ortho, you do aligner checks, you do some initial consults for maybe a younger adult that's looking around. I think parents are still going to bring them in for a consult. You're not going to do a lot of braces consults online, but you can do a lot of Invisalign or other clear aligner programs. And I think on restorative dentistry, a lot of post-op checks. And I think as we talk about COVID and what's going to be new regulations, we're all talking about the PPE and the cost of PPE, and even the extra time between patients to do more disinfecting. So if you can take these 10-minute to 15-minute post-op appointments and move them from your office to a teledentistry platform, not only are you saving PPE, you're opening up chair time for other revenue producing procedures. You're really optimizing the flow in your office. So I think in dentistry, you know, a lot of these extra costs and a lot of the business challenges that dentistry is going to have post COVID, you have to start looking at how other businesses have become more efficient. And I think you've seen that through tons of examples during this COVID on how quickly they can move to a virtual or an online presence. And I think in dentistry, we'll never be able to do root canals and fillings online, but there's a lot of communication and a lot of, I guess we call it palliative care, different things like that, that can be done online. And I think you have to embrace it.
From a customer service standpoint and a convenience standpoint, but still keeping paramount that you have to be thorough, you have to be complete. Rob, what things are you comfortable doing as far as a teledentistry visit? For example, how about a new patient visit? How do you feel about that? Let me give you a scenario. The parent calls the office. Yeah, I've got a couple of kids here. We're new to Baton Rouge, Louisiana. We've heard great things about your office. But I don't really know what my kid really needs or doesn't need. How do you feel about incorporating some sort of new patient interview through a teledentistry visit versus just a voice over the phone, which is what we've done forever in the past? How do you feel about that?
Oh no, I think it would be. I think in that particular situation, I still got to put my eyes on that kid. You know what I mean? But with that said, I think a lot of our initial interaction on getting to know a family, I mean, even on a teledentistry thing or new patient, you could have a virtual tour. So what I think is you could incorporate a whole bunch of your office differentiators into a teledentistry visit like that, you know? And I think if you do it that way, and with, like Michael said, all of these being millennial parents and younger kids that are used to the technology and the video stuff, I think it would prove to be, in some cases, a good introduction to the office, to the patient, to the eventual patient. So the one thing, and I'm stumbling with the answer because this is really new in the sense that what value does it have? I mean, yeah, sure, definitely on the PPE stuff, all of that, time, efficiency, and all. But on the flip side, which you talked about with some liability, consent, I mean, all of this needs to be tidied up. And I think there's a lot of different sources out there talking about this stuff. And I think it's going to take a lot of training. And I think that the other thing is some people are going to be good at it and some people are not. I mean, if you're not a good communicator, in my opinion, I'm not sure this is something that you should do, frankly. You know, I think if you're a great communicator and you're able to get a feel for people just by interacting this way, then yeah, I think it's an adjunct. I think it's good.
I think you could have a practice, like you said, you have a practice ambassador, you have a practice concierge, one of your staff members that can field that type of, tell about the practice, right? I don't think you want to get into that traditional new patient exam in a pediatric type of setting. You're not going to go through and try to look at the teeth and chart the teeth and things like that. I don't think that's worth it. But I think, it's no different than having the videos on your website. I think even though some people are getting Zoom fatigue, I think, you could announce things out there of like, once a month, we're going to have an interactive Zoom thing of maybe it's the doctor, maybe it's the practice ambassador, that maybe 20 people from your community join on that are looking for a dentist, and you can field questions. You tell about your practice, open it up for questions. I mean, Facebook Live events, things like that. But you have to I go back to a doctor I worked with who's a very good pediatric dentist. He graduated his peds residency mid-70s maybe. When he first got out of practice, his new patient onboarding to his practice was, you bring your child in, we just have him sit in the chair, have him look at the office, see if he's comfortable. Maybe we get him to open his mouth, but then that's it. Then have mom bring him back the next day, and we'll try to clean a little bit. And the new patient appointment could have been 3 days in a row. In the 1970s, when it was usually one parent was working, and unfortunately it was the women that were like, you take care of everything around the house, and that maybe somebody would do that and go to the dentist 3 times. Not today. So we have to be able to, it's that push pull, and sometimes you react to what the customers are demanding. Sometimes, you're a visionary like Steve Jobs, and when he said, the customer doesn't know what they want, I'm going to tell them what they want. They didn't know they wanted an iPhone or an iPod. But I think for dentistry, especially what's going on health, the more we have to close that gap, and we can't sit around and be 15 years behind medicine. That gap has to close. And this high service you're getting on the medical side, and the virtual appointments and the telemedicine, maybe it's not as intrusive as dentistry, but we've got to bridge that a little bit, because that's what the consumers are going to demand. And we've talked about it for a long time, is it's healthcare, but we have to remember the majority of patients out there view dentistry as elective, right? We've seen the studies. Only 60 to 65% of adults go to the dentist once a year. And we haven't moved that number in like 25 years. So we have to view it sometimes through a retail prism also, on how do you attract customers? How do you deliver customer service to customers? Because the days of I'm a dentist and I'll tell them how they need to come into my office and how everything works, that doesn't fly anymore.
Yeah, I think that what I find fascinating about the conversation, which Michael brought up, is the cost of a patient visit. Rob, you brought this up too. What is the cost of a patient visit now with the personal protective equipment for everybody concerned, and the much longer visit that it takes? So I think my curiosity started spiraling into, how much information could you give a new patient in pediatric dentistry, the parent, get the kid oriented? When I did my pediatric dental residency, I remember they were calling it a happy visit. And I thought, who's happy? It's my job to make the kid happy, but I don't see a lot of happy people here. I'm happy. So it seems to me you could actually, Rob, how do you feel about this? Couldn't you do something like this and make some decisions? With some questions to the kid, you could see their behavior. Question to the parent: when's the last time the kid saw the dentist? What was that like? How often do you brush the kid's teeth? I'm not saying the doctor has to do this. I think it is important for the doctor to make a cameo appearance, like a live one, for a few minutes, saying something like, well, I know that that Brenda Hilda here, it gave you a bunch of information. May I answer any questions for you? Most people won't take a lot of your time. So the image that I'm looking at for coming, I'm not going to say coming out of this COVID mess. I'm not sure when that's happening. But being thriving as you perceive what's going to be next is to incorporate people into this very modern teledentistry idea, and that your office and your business is very hip, very modern, very with it. You have anything else to add to that, Rob?
No, I think it's, like Michael said too, I think it's part of your overall plan, but I don't specifically consider that teledentistry in the formal mode of what teledentistry is supposed to do, right? I think if what you're talking about is more of the initial impression, the meeting, the exchange, and you are going to get some information that way. And I think that's a heck of marketing. I mean, there's no question about it. But in the true teledentistry sense, I think the way we're seeing it is we're looking at how much are the folks going to get out of this, and how much information am I going to get out of it that's going to drive an outcome or a decision. And I think when I look at it that way, it's less, it's certainly a differentiator. It certainly is, but it has to have that go back into the business mode, that net value to it, because it's a time factor now. And to do what you're saying, how do you sequence a doctor's time, right? Because even if it is a pop-in, it's a pop-in till you get 2 questions. And then it's 20 minutes.
Right.
And then when are you going to do that? At what point of the day? You see what I mean? So that's what I'm saying. To me, I do think it has promise. I definitely do. And I think it's a way of the future. But I think for dentistry, it's in an infancy mode. And so many of these cogs need to be put into this to make it something that, okay, I've got a product now. Now, this product makes sense for AIPD, for our practice. This is going to be a good service to the community, to the families, and we've got it in a way that it functions. Because to me, coming out of this thing, the one thing I don't want to do is incorporate something and it either not go too well or it be looked at as, yeah, you're grabbing money. You follow me? Yeah. So I don't want any of that. So early adoption, yeah, man, I'm sure, believe me, we're doing our due diligence. We're looking at it. We're trying to figure out how to incorporate it. We're looking at it from the standpoint of staffing, because, even if I'm not going to be doing that whole thing, I've got to dedicate somebody to do that. And that person's got to be trained, and they have to be well-spoken, great communicative, real positive outlook on things. I mean, all of that goes into this. So I think I think it has the potential, but it's going to take, in my practice, in my opinion, a lot of due diligence and drilling it down to find out, okay, what is the value to it? What's the value frontier on this? What's the cost frontier on it? I mean, is it going to replace something else that is sustainable and growable?
Well, I think that if you have a multi-doctor practice, you can have the actual practice running business going on at one time, and you can have dedicated times for these teledentistry visits that people are told, we do offer. You can come to the office, or let's say it's a kid, you can come to the office. Here's our appointment schedule. Here's what I can offer you. Or we do have a teledentistry option to begin with, and here's how that scheduling works. So I know, Rob, that you're quite interested in and very effective with systems. So I hear where that's coming from. I want to ask another question. One of the things that both of you agreed on during our actual pre-conference meeting and notes that you sent through was this idea about knowing your numbers. And I've said in other venues that some people watching me have seen with Martha Ann Keels and Bobby Elliott and Phil Slonkowski. I think Rob and Michael were on board with that as well, that I never had to know any numbers. I really didn't. I mean, I ran an office with my orthodontic practice was one assistant and one front desk, and we didn't accept insurance. So it was a different time, a different place. It was a concierge. Now it's called a concierge, or a boutique niche practice. I didn't need to know my numbers. I really didn't. I was so busy because I wasn't competing with anybody. Everybody else was doing more of a volume deal. That was not my target, because I wasn't trying to raise the patient visits and lower the fees. I was trying to lower the number of new patients, and raise the fees, which I don't mind saying I was quite successful at. But with the numbers you need to know, what do the two of you have to say about what are the critical issues that people had really better understand? I think about Martha Ann Keel saying that I have never known my practice as well as I know it now, having the veil of tears of COVID descended upon me. Michael, what would you say first? Give me a couple things that people really need to be paying attention to.
So, I mean, being biased a little bit, one of the major reasons the DSO industry even developed was the lack of knowing numbers and knowing the business parts of a dental practice, right? So we've talked about this. There's other factors that have accelerated over the last couple of years, but when it started back in the 90s, dentists didn't get this training. They'd gone undergrad in life sciences and then gone to dental school, but were told, hey, this is a profession where you should own your own business, but we're going to provide no business training. So I think that's how you started to first see the early DSO 1.0 was getting in there and kind of working on that part is like, we'll do the business, you do the clinical dentistry. It's developed into a lot more things over the last, 40 years or 30 years and counting. But I would say, I think the thing that I see the most of is doctors talk a lot about gross production. This is my gross production. When I talk with residents and associates, I want to get paid on gross production. And what I tell them is gross production is a made up number. That's it. You can't pay your electricity bill based on gross production. You can only, as a single business owner, you pay your bills based on what you collected that month in the bank and what you can write a check for to pay for that. So I think what I'm focused on now, because I think with a lot of DSOs and a lot of consultants out there, and there's more knowledge getting in out there and great CPAs and things like that. The thing I've been focused on lately, and I think dentists should think about this, is gross margin. And let me define, because you can define things differently. When I talk about gross margin, I am talking about your net revenue, what you're expecting to collect. So if you are a Medicaid practice, I don't care if your UCR for a procedure is $100. If Medicaid's paying you $30, that's your net production. That's your expected revenue. If you collect 100%, you're going to get $30. So that's your revenue. And then what I want to take out of that revenue to get to my gross margin is I want to take my staff cost, my doctor cost, if I'm not a solo practitioner. I want to know what I'm paying my doctors. I want to know what my dental supplies and lab, depending on your business. I want to know those things, and that's going to give me my gross margin. And I think one of the areas, and this is across all industries out there, one of the biggest mistakes business owners make, and even large companies make, is they miss out on what we call a gross margin compression. So your business, let's say you have a solo practice, and the first year you did 500,000, and the next year you did 750, and the third year you did 800, and now you're at $1 million, and you're like, I'm killing it, right? I'm killing it. My revenue's going up like this. But if your cost of doing that revenue is going up in those 3 or 4 areas I talked about, you might have less profit. And you hear this a lot when people say, I was making more money when my practice was doing $1 million than I am now that it's doing $2 million, right? So you find these sweet spots. So that's your gross margin, because your rent is your rent, and a lot of your utilities are utilities. A lot of that I consider more fixed overhead, but you got to look at gross margin. I think in this COVID time, this is where that PPE thing is coming in, right? Because unless you're a fee-for-service practice, we now are increasing our dental supplies, but we're not moving our net production. So I went through a whole exercise, and I focused on pediatrics to start with. And I said, okay, I'm going to take 4 procedures. I'm going to take a new patient hygiene exam, or new patient hygiene appointment, a recall hygiene appointment, a 2 fillings appointment, or 1 filling appointment, and then a pulp and a crown. and what is my gross margin on those based on my UCR rate for a fee-for-service patient, Medicaid, and then I took Delta Dental, MetLife, and maybe Cigna, my top things. First of all, you should understand those and see, because that can help you determine if you should be in network with somebody. I mean, in Texas, Delta Dental, some of their fees are below Medicaid. Mm-hmm. So as I started looking, I said, okay, if it's a hygiene visit, I have anywhere between, and if we can do the hygiene visit, let's say a half an hour, my cost for that assistant, an $18 assistant in some of my markets, that's $9 of staff cost. And then I compensate my doctors on, depending on their contracts. So I have a doctor cost and now I have my supply cost. Well, I'm adding $5 to $10 plus, depending on if I'm reusing, are my doctors able to reuse the KN95 mask? Can they use more than one a day? Can they make it last a day? So we took some numbers and I figured, okay, I have $5 extra cost if they can wear this mask and see 30 patients in a day. Well, that $5 is like 4 margin points. So if my gross margin was 50 before I paid any of my other stuff, now it's gone down to 46. But my rent hasn't gone down, my utilities hasn't gone down, my benefits haven't gone down, none of that fixed cost has gone down. So all I did was, I can't charge the patient. Well, we can talk about charging the patient for some of the PPE, but if we don't charge the patient, then all we do is we're compressing our gross margin. If you get into a restorative procedure, depending on, there's some new stuff out there about nitrous and the tubing and everything. So we looked at the Porter Silhouette system, which is a one-use cone and tubing. That could cost you $16 to $20 a patient. Well, insurance isn't paying for that. So now I could lose 10 margin points on that if I decide that's what I'm going to use. And I think a lot of doctors understand what their production and collections are, and that's about it. And I think you really have to look at that gross margin, because that's going to lead you to a bunch of different decisions: staffing, insurance participation, associate doctor comp. And I think that's where you got to understand it.
Now, before we hear what Rob has to say, you can tell that Michael really knows this stuff, and I really don't. I'm listening to this. I may as well be listening to a foreign language, and I'm just thinking, I don't know. If I was in the game now, and I have been asked by a number of colleagues as well as postgraduate students, well, what would you do? I probably wouldn't open my own office. I'm just not prepared. I'd probably go to work for Delarosa, or well, all right. So he wouldn't have me, and Schwartz already knows me. Well, forget it. I mean, they call me the Bronco. Well, I would know the game and play to win. That's the saying from Lyle Johnston. Know the game, play to win. Now, so
real quick, before Rob jumps in, when I talk about this gross margin, we went down and we built a spreadsheet for every single thing that's going to be used in that appointment. Are there cotton rolls? What's the plastic you're putting over the light, the infection control stuff, the sterilization pouch for this? We line itemed everything and said there's 2 cents in this, there's 6 cents in this, there's 15 cents in this. And it sounds tedious, but I can tell you from a DSO standpoint, when I talk to an average solo practitioner, their dental supplies, the ones that don't know the numbers, their dental supplies are running 9 to sometimes as high as 15% of their net production. And DSOs, depending on the size, if you take somebody the size of Heartland, they're probably running at 4%. Mm-hmm. Somebody our size, which is 25 offices, we run in peds, we run at 5.5 to 6. Rob, I know, knows his numbers and he'll get in. I'm sure he's pretty efficient, but the average solo dentist, they're getting killed there. And really, if you go down and break down every little input into an appointment, that can help you get to understand your cost structure. But go ahead, Rob.
If you're not prepared to do this, and I wouldn't be, you have to hire people that are. Maybe you don't want to go to work for someone else. Maybe you want to run your own shop, your own show. Good. But you have to hire people, and they have to be the right people. Rob?
Yeah, I think Michael's stuff is fantastic. I think you've got to get down to that level in your business, but you needed to get down like that before COVID, because there are three things that happened with COVID. Number one, it's this unknown entity that even those who are watching those margins didn't know what to do with, because the templates don't hold up right now. Because you were talking about $5 or $10 with PPE. I wish. I mean, if you throw in you throw in the face shields, the head covers, all of this stuff, it can be $35, depending upon where you can get this stuff right now. And that's becoming less of a problem, but it was a tremendous problem in the first week. Our practice went on a national scavenger hunt to find this stuff at a premium price. I mean, we ended up, the first batch of the KN95s we got were, I think they were $373. The second batch was $514. So there you go. And it didn't change what you had to do for the patient, right? So I kind of see this thing in that we had something happen to us that we just should not have had happen, but now that it did, what are you going to do with it? And the first thing you have to do is you got to realize where you were, because this thing is going to expose people more who don't know this stuff. Because even filling out the PPP application and all, if you had trouble figuring that stuff out with exact cost here and exact cost there and what was included, what's not included, you got a lot more due diligence to do than you think you do. And it's fine that you got the loan and the forgiveness and all that goes with it. But moving forward from that, the lesson should be cash is king. You have to know what the cash reserve is and your ability to get to cash if something like this happens again. You know, the emotional turmoil that it takes to furloughing all your employees and worrying about their families. You know, you own a business, you're responsible, you're accountable to people. And this unknown thing just, it can work on you in a number of different ways. And the only way I know how to make it right for the people I'm responsible for is make sure this business is viable, functional, and we're put in a position that we can look at what's differentiating us and do we still need to be doing this? You know, that's why I'm saying the teledentistry thing, I'm hesitant only because of the gross margin on it and what it's going to take to institute that kind of program in a fashion that I know is the right way to do it according to the culture. So I think the exposure of what we all had, right? Because I can tell you, as tight as I know the numbers, I'm not going to tell you I didn't burn midnight oil to figure out, okay, where's all our cash reserve? I know we've got this equipment, account. I know we've got this account. We've got that account. We've got a pension account. We've got all these things. And we've got the rainy day account. But is it enough? And in this case, it would prove not to be enough, because if we had to pay all the employees without the ability to hook on the government, which I'll never want to depend upon again, it would have been a different day. I mean, there'll be some people we wouldn't have been able to bring back, quite frankly. So I think that's the one thing. The second thing is that I think, and we talked about this earlier when we did one of these things with you, Gerry, the Black Swan event with, Nassim Taleb, who the author of that, and he talks about these buffers, the protection buffers that you need in your practice. Cash is only one of them. The other thing is what am I going to do to protect myself when, if I have to sign up with a program and they're not going to increase the fees for 2 years? What's my program to negotiate? Am I big enough to negotiate? What is that gross margin on that? So I think if you weren't a business student before, you absolutely have to be a business student now. And I feel like there's probably going to be some practices out there, like some restaurants out there that are poorly run, ain't going to make it. They're just not going to make it.
Yeah, I read something this morning that the prediction is that 1/3 of the restaurants in New York City either will never reopen or they're going away. The two things being connected with Michael in business, the two things, there's only two things that are essential in order to surviving is one thing, but I don't think about survival. I think about, you got to do better than just survive, brother. That ain't going to work. The two things is consistent customer service, which is why people are going to come back. And it's why they're going to tell their friends. Not spotty customer service, consistent customer service. That means consistent team members that produce a consistent emotional product, not just with the parents, not just with the patients, but with each other, that they are very consistent, that people know what to expect when they come to the office. The second one of the two, right, Michael? You have to know how to run a business, because it doesn't matter how great your customer service is. If you don't understand these things and you don't understand how to duck and weave and dance with these numbers, if you don't understand that, doesn't matter how good your customer service is, you're not going to make it. Just like it doesn't matter how much you know about the numbers, if people don't want to come to you because they just don't like you, they don't like the office, they don't like the feeling, they don't like the culture, you're not going to make it. Closing comments, gents. Michael first.
Well, just following up on the numbers part of this again is I also think that you should understand what your break even number is. That's something that, we haven't talked about. And like Rob, we've done a fair number of these. I think really starting to understand your break even. And I think the restaurant comment is perfect. Is the problem the restaurant industry has is, in order to break even, most restaurants depend on that Friday and Saturday business to cover nobody really coming in for dinner on Monday and Tuesdays, right? And they can shift their staff, they can do different things. But when you look at New York City, the reason why most of those statistics you say, it's their fixed cost. It's the rent. It's your occupancy cost. What is your rent? What is your base rent? If you have a triple net lease, what are your CAM charges? Because people's property taxes aren't going down, right? We know that. And what are your utilities? And I think from a restaurant, and the problem the restaurants are having is at 50% capacity, no restaurant can make money. It doesn't matter if you have, like you said, the best customer service. If Thomas Keller had a restaurant and he could only bring in 50% of what he needed, what he normally does, he's not going to make money unless you double your prices, right? And in America, we expect every year for prices to go down, right? So I think from a dentistry standpoint, you have to understand your break even. And I think, just back of the hand or back of the envelope, a lot of, and I'll go to general dentistry offices, a lot of solo practices, the first $500,000 in a year is covering their cost. When I look as a DSO, if I have a one doctor practice, it's more like $750,000. The first $750,000 in the year of production, that's getting me to break even. So if I have an office that does, in pediatric dentistry, a one doctor practice, the sweet spot from a DSO is about 1.2 million in collections. And that's where you're maximizing your profit margin. If I only do 600,000, I'm going to lose money. If I do 800,000, I'll have a very slim margin. But at 1.2, it's really good. Now, why isn't it higher? Well, once I get past 1.2, if I have a mix of Medicaid and PPO, that's about as much as a doctor can do. So now I got to hire doctor number 2. Well, when I hire doctor number 2, that automatically eats my margin. So if I have a 2-doctor practice, but it's only doing $1.6 million, I'm making less money than $1 million practice with one doctor, right? So that's where I go back to previously saying is understanding your numbers, understanding your gross margin, and then what's your break even. And I think that's where some of these doctors that haven't known their numbers, that's where they're going to get stuck, because if they either the demand doesn't come back or their costs go up so much that they're fighting every day just to get to break even, then I think it goes back to what you said, Gerry. Is that the business you want to be into, where you're busting your tail and at the end of the day, you just paid your bills?
Yeah.
And I don't think anybody got into dentistry to do that.
When the reason that I'm sort of getting tickled here is I'm from Milwaukee originally, and my father never finished high school. We never owned a home. My dad never knew where his next dollar was coming from. Well, when I finally get into private practice after 13 years of college and education and and different deans suggesting that I continue my studies at different universities rather. I digress. There was a month, and I was doing great, man. I mean, it was working, and I thought there is money coming in. Well, there was a hit, Rob, where once the rent was paid, the taxes were paid, the employees were paid, the utilities were paid, all of that was paid. You know what was left for me? Nothing. Nothing was left. I went nuts. I said, what is it? What? Rob, closing remarks.
Michael, he could have gone to a meeting and said, but man, I grossed this.
That's right. That's what I was thinking. I mean, talk about it.
Production is great.
Right. Yeah. Yeah. So look, I mean, I think I'm always optimistic about things, and not wasting a crisis like this. There is opportunity.
Yeah.
So for those people who absolutely love pediatric dentistry and love what we do for the kids, just knuckle down, work at it. You know, you're gonna be fine, right? But it's a different world, and you have to decide what your culture is, what your vision is, what type of practice do you want to have. I mean, I'm like Gerry. I think if I were a kid coming out with 6-figure debt and I didn't have a lick of business sense, first of all, I don't know where I could get the money from to open up something solo anyway. But man, that might not be what I'm thinking about, because it's, you know, I think Michael probably knows the numbers more than me. I think it takes about 9 years, 7 to 9 years to get out of that student debt load, right? So think about that. You know, if you're going into practice and it's going to take average cost to open up a small office is north of 500,000, you know, maybe 700, maybe 800. And then, like Gerry said, you busting it, man, you the king, and you're rolling. Well, at the end of the month, when there's no money to put in your gas tank, is it, where'd it all go? You know? So, but I don't know. I think knowing your numbers, coming through this, I think there's an opportunity to trim fat, because one of the things I've noticed, even in my own practices, when it's all gravy and everybody's doing fantastic, it's easy to ignore that little 1% that came in, right? That 2% that came in. Or, man, we got to get this new piece of equipment. This new laser's beautiful, you know, and then you're tagging on, you know, 80,000, 90,000 bucks and saying, yeah, but look at all the stuff we can do, and it's all great. And it is. But does it differentiate you? Is it necessary? Do we need to do it the way we've always done it? And I think now is the time to just think every day about your business plan. What's my business plan? What am I doing? And everything that Michael said is critical on as you get deeper. Like, you need to know that cotton rolls are, you know, 17 cents for a pack of 4, whatever the deal is. You know, you need to know all that. But before you can get to that, you got to figure out if that's you, if you can do that. Because if you can't, life will be a lot easier if you decide to work for somebody, or you decide to you know, go back to school and be a hygienist, you know, whatever it is, you know.
Or your other option is hire people that know what they're doing, that you can trust.
Yes.
And make sure they're doing their job.
Right.
Gents, I really do appreciate all your time, your expertise. Thanks very much. I'm looking forward to seeing you both of you without a mask and without gloves.
There you go. Thanks, Gerry. Thanks, Michael.
Everybody. Thanks, Rob. Thanks, Gerry.
Bye-bye. Thank you.